Today we'll be looking at the familial renal cell carcinoma and their associated syndromes. To begin with, first a few questions. First one is, what is the gene involved in the hereditary papillary renal cell carcinoma? We are asking the gene. Now the second question is, we want to ask in case of the hereditary leiomyomatosis, what are the clinical manifestations or clinical features? So here we'll be answering these questions and doing in detail. To begin with, first is the von Hippel-Lindau disease. So here the mutation, it lies in the VHL gene 3p2526. So what are the clinical features? It includes the clear cell renal cell carcinoma, renal cyst. Next there is the renal angiomas. Next, so this is basically benign. Then there is the CNS hemangioblastomas. And so this is basically benign. Next there is also the pheochromocytoma. Then also the neuroendocrine tumors. Then there is also the cystadenoma and the endolymphatic sac tumors. Now moving ahead, we look at the hereditary papillary renal cell carcinoma. Hereditary papillary renal cell carcinoma. So under this, the mutation, it lies in the c-MET proto-oncogene. And this is nothing but the 7p31. So here the clinical features is, there is multiple and the bilateral type 1 papillary renal cell carcinoma. Next we look at the tuberous sclerosis. So the tuberous sclerosis is the mutation of the TSC1, that is a 9p34, and the TSC2 is 16p13. So this is the gene associated with the tuberous sclerosis. So what are the clinical features of the tuberous sclerosis? Clinical features, it includes, there is the clear cell renal cell carcinoma. There are the multiple renal angiolipomas. There is also the polycystic kidney disease, cutaneous angiofibroma. There is the periungual fibroma. There is shagreen patch. Next, there's ash leaf macules. And there's cardiac rhabdomyoma. Then there is subepidermal nodules. There are also the cortical tubers of the CNS. So the cortical tubers in the CNS. Also the pulmonary lymphangio-myomatosis. Myomatosis. Next, we are going to look at the Burt Hogg tube. The Burt Hogg tube. So under this, the mutation lies in the BHD gene, folliculin. So this is 17p11. So what are the features of this BHD? The features include there is the multiple chromophobe renal cell carcinoma. Next, there is the hybrid oncocytic tumor. Next, as we move, we also have the oncocytomas. That is the oncocytomas, and also the clear cell renal cell carcinoma. Then the papillary renal cell carcinoma. Next, the fibrous, the facial fibrofolliculomas. Then also the lung cyst and spontaneous pneumothorax. Then we look at the hereditary leiomyomatosis. Leiomyomatosis. So under this, the mutation, it lies in the fumarate hydratase. So fumarate hydratase is nothing but the 1q4243. And what are the features? So basically it is a type 2. It is type 2 papillary RCC, renal cell carcinoma. And other things to note is that it is a collecting duct. Collecting duct renal cell carcinoma. Next, if you see, it is a leiomyoma. It is the leiomyomas. This is of the skin or the uterus. Then we also have the uterine leiomyosarcomas. Then we look at the Cowden syndrome. So this Cowden syndrome, the genetic manifestation is P10. So this defect in P10, there's 10q23. And what are the features? Features includes that it is a Bowden. It is benign and malignant breast tumors. Then there is also the epithelial thyroid carcinoma. And next we also have the papillary renal cell carcinoma. The papillary renal cell carcinoma or the histological subtypes. Now what we'll do is we'll go back to answering our questions. So the first question we asked was, what is the gene which is involved in case of the hereditary papillary renal cell carcinoma. So here the gene involved is nothing but the c-Met. The c-Met, that is a proto-oncogene. That is the 7q31. Next, we look at the next question, that is the hereditary leiomyomatosis. So we ask the clinical features. So in case of this, just to highlight, the genetic is that there is a fumarate hydratase, and looking at the clinical features, it includes a type 2 papillary renal cell carcinoma, then also the collecting duct renal cell carcinoma, then also it involves the leiomyomas, and this is of the skin or the uterus as well. Lastly, it also has the uterine, it has the uterine leiomyosarcomas.